My name is Dr. Bir Devinder Singh. I'm a senior interventional cardiologist at Patiala Heart Institute. And today I would like to talk about hypertension and its preventive measures. Hypertension is highly prevalent condition. If you look at the data from India itself, the prevalence is around 30%. That is one third of population is suffering from hypertension. Those who are suffering from hypertension, half of them are controlled on blood pressure medications and the other half are not controlled. And even some of them, that is out of the half which are not controlled, one quarter have not actually started the medication or not compliant with the medications. So it's highly prevalent condition, and it has got a great gravity because it can cause a number of vascular events like stroke, myocardial infarction, that is heart attack, and heart failure, kidney disease, progression of nephropathy, and retinopathy. So it has got an implication widespread, not just at the heart, brain, kidney, and other organs itself. Because heart supplies a blood supply to every organ, and since the blood is going to every organ, the high pressures will cause detrimental effect on almost every organ. So that's why it is important to have a blood pressure control. Since it's a silent killer, what it means by silent, it means that blood pressures when high are not giving much of the symptoms to the patients. Like headache is commonly reported symptom, and it is detected that the blood pressures are high during the headache. So people assume that headache is because of the hypertension, but it is not true most of the times. It is not the symptom by the hypertension itself. It is an incidental finding at the time of a headache, which happened due to be the other cause. Hypertension remains silent, especially if it is gradual. Only when it is very sudden that sometimes it may cause pounding, pulsations, and other things, and uh, or breathlessness or cardiac demand supply mismatch with causing chest pain and other things. But most of the times it will remain silent and progressively cause detrimental effects on all organs, and will manifest when the end organ stage has happened. So it is important to screen every individual for hypertension because it's not only a disease of elderlies as was presumed earlier. Now we do see patients in a younger age with hypertension. So we need to check our blood pressures at regular intervals after say 20, 25 years of age at least. And because only if we detect early are we able to treat early, and then only that organ damage can be prevented. Second thing is the blood pressure happens because of the unhealthy lifestyle, but not always. It happens due to age because the stiffening of the arteries happened. Uh, but it is not always true. So most of the times the blood pressure cause of high blood pressure is idiopathic, and but sometimes there is an underlying cause like coarctation of aorta, thyroid disorders, parathyroid disorders, pheochromocytomas, or there can be other causes like Cushing syndrome or iatrogenic steroid abuse. uh, Obstructive sleep apnea is one of the common causes which is missed because there is a high sympathetic surge because of the obstruction at the night and desaturation. And the blood pressure medications also are not giving the adequate response, desirable response in these individuals who are on antihypertensive drugs. We need to search up for a secondary causes, especially in those who are younger patients, that is less than 35 years. There are some genetic causes of hypertension also, which are rare. And then secondary causes like kidney disease itself can cause hypertension because kidneys are central to volume regulation. And also it is the adrenal glands disorders, incidentallomas can be when functional, the Cone syndrome, which we label as, because they give mineralocorticoids, and those mineralocorticoids can cause volume retention. And all these secondary hypertension causes are diagnosed by doctor when there are certain circumstances, like bilateral renal artery stenosis can present with a sudden surge of blood pressures and breathlessness and heart failure itself. There can be a renal buoy on examination. Then thyroid disorders are suspected based upon the symptoms of hyper or hypothyroidism, like cold skin or warm, sweaty skin, tremors of hand, or there is a goiter, or there is a ophthalmopathy present or dermopathy present. And so there are examination do reveals a clue in those suspected individuals. But otherwise, in elderly patients, it's essential or idiopathic hypertension which happens. Though the cause is not known, but we do know how to treat it. So it is important to diagnose early and screen in every individual. So if we look at the cause treatment part, the first part is the lifestyle part because it helps to lower the blood pressures by 8 to 10 millimeter of mercury, which suffices in many individuals. And also the healthy lifestyle not only happens to control the blood pressure, but it prevents the disease, other diseases like metabolic syndrome, diabetes, and other cardiovascular problems like myocardial infarction, heart attack, stroke, and many more. Like quitting smoking, which is a part of lifestyle, will help to prevent cancer also. So the lifestyle modification is just not for the control of hypertension, but for the prevention of all other diseases, and helps to regain that healthy sport. So that healthy lifestyle includes cutting the salt intake, if possible, to less than 5 gram per day, or even to 2 gram per day sometimes. And you can take a doctor's or dietitian approach with what is desirable in your case. So then a low-fat diet is recommended, which especially includes avoidance of trans fats and saturated fats. MUFA and PUFA are acceptable. So all fats are not equal, I must stress here. Then we need to increase green vegetable intake and fruit intake. Fruits are essential parts because they provide a lot of antioxidants. They're rich in lycopene and other vitamin and minerals, which helps to boost the metabolism. So they should be a part. At least two portions should be there. And then there are a number of diets for hypertension. Like there is a dietary approach to stop hypertension, and the Mediterranean diet, which has been shown to have a reduction in the cardiovascular mortality. Now, so most of the times that different dietary approaches have failed, but few diets like Mediterranean had a lot of favor because the trials do show that they help to prevent the cardiovascular events. And this diet actually includes fish, green leafy vegetables, legumes, nuts, and the diet dairy products are not a lot preferred here, though they are a part of it. So we need to cut down on alcohol. We need to increase the physical activity. At least 45 minutes per day is recommended, and at least 5 days a week is recommended. This is a bare minimum we need to set as per the individual, and higher is the better. But there is a limit, and we need to increase gradually. We cannot go suddenly because, like, if a patient with a high blood pressure has some chest pain, and just based upon our advice, he goes for a long walk or a external exercise, it can precipitate myocardial infarction or heart attack. So a basal condition of every individual determines what should be that uh, duration of exercise. So we need to cut down on caffeine containing products like coffee, tea, cola, and the smoking quitting is a paramount, which we stressed before also. So this healthy lifestyle helps us to prevent from other diseases also, but in many cases it is not enough. It is important to stress here that it is just not to initiate the healthy lifestyle. We need to maintain it, and it is a difficult part because many individuals initiate it, and after a year or 6 months they become fed up of it and they leave it, and they just resume their those unhealthy habits. So it is important that we just not initiate the healthy lifestyle but maintain it, and it is for all individuals, just not hypertensives. So the second part comes if the blood pressure is still not controlled, or the patient has target organ damage at the beginning, or the blood pressures are in stage 2, that is more than 160 by 90. Then we need to start the pharmacotherapy or drug therapy. This drug therapy is started by the doctors whom you will consult, who will assess the target organ damage, and then a certain which therapy, which drug will be best for you. So that we need to initiate it, and after initiating it, we need to measure the blood pressures continuously. Whether the blood pressures are well controlled or not, a single reading is not enough, especially if we go to the doctor and just check it. What is the blood pressure? So if the blood pressure is high in the clinic, and we just increase the therapy and drug dosage, this is not a good idea because sometimes the blood pressures at home are different from the clinic because of the stress of the visit or other things. So we need to check the blood pressures at home also. A number of readings at multiple places at multiple times do help us to get what is the best line of further management. So we need to sustain a blood pressure control also, just not get an initial blood pressure control and then forget about it because it's a lifelong thing. This is it. A high blood pressure anywhere in between or fluctuations of blood pressures are also not good. So after a pharmacotherapy, I would like to stress that it's the prevalence we talked about and the control. The control, we said almost 50% of the patients are not in good control because the number one factor is actually the compliance to the drugs. The patient is not able to adopt that drug into the dietary part. That is, he does not accept it, that he has to take it drug daily. He feels okay. After sometimes the blood pressures are normal, he feels that he's okay and blood pressures are well controlled. Why should he take the drug? This needs to be stressed that the blood pressures are controlled because of the presence of drug. Once you stop taking drug, the blood pressures will slowly rise. Next day, he will measure the blood pressure after stopping the drug. He'll feel the blood pressures are okay and it's okay. The drug he has been taking for last 6 months. There are levels built up in the body. So once he stop taking drug after say 2-3 weeks, the blood pressures will rise to the previous condition. And since it is a silent condition, he will not know it, and he will forget about it after maybe for 2-3 days that the blood pressures are okay after stopping the drug. Blood pressure was okay with the drug also. So that part causes the damage and further on presents with the heart failure and other problems. So it is important that we understand this part, that the drugs are just acting till the time they are taken. So the blood pressure, if controlled in the presence of drug, it will not remain controlled after you stop the drugs, and the rise will be gradual. So that's all from my side. Thank you.